I'm Karl Kieburtz. I'm a neurologist by training. I'm on the faculty here. I'm the Robert J. Joint Professor in Neurology, the Director of the Clinical and Translational Science Institute, and the Senior Associate Dean for Clinical Research. So the Affordable Care Act is actually, even though it's legislation, it's like a social experiment. There's a greater number of people who are going to have health insurance, and how we deliver care is actually going to change through the Affordable Care Act, or at least we're going to try to change it. So we're going to be making new ways of delivering health care to people with the intention of making the health of those people better. Most healthcare organizations are really focused on delivering care to patients. But part of the Affordable Care Act is to think about not just the health of patients and how well you deliver health care to them, but the health of a whole population. Maybe people who aren't even coming for health care, but you wish were coming for health care. How do you look at the health of the whole population? Well, that takes the ability to gather information, which we will call biomedical information together in such a way that you can actually analyze what's happening in the population. CTSI is in the place to help other researchers with those kind of resources, the ability to hold and analyze information. The CTSI itself is not intended to do research so much. We provide what we call infrastructure, that is the tools, the people, and the processes to help other researchers get their job done. On the other hand, we can help push people in the right direction, and one of the things we have are granting mechanisms and teaching courses and training programs to help get people in place and get them the right skills to be able to help change the health of the population. We're keenly interested in that happening. The entire medical center is keenly interested in that happening. We want to be there to help that process move ahead. In this country, there's an organization called the National Academy of Sciences, which is one of the most prestigious groups of scientists in the country, and they have an Institute of Medicine, which is focused on medical care. That institute made comments about this CTSA program, the Clinical Translational Science Award program, of which our institute is one of the awarded institutions. They made several comments about what they thought it was important for CTSA awarded institutions to do. And a lot of that focus was on the health of the community. It's very easy for us who are interested in translational science to focus on what's happening at the bench-based science, what's happening with laboratory animals. But what that report really asked us to do is not only focus on that, but think about how the results of those experiments actually translate into health of a population. And so that will probably change the focus or add new areas of focus for our CTSI as well as for other organizations around the country. Another piece of that report was to really call on the awarded institutions to work together in a more coordinated way, and we're already starting to do that. Part of what we want to do for the CTSI is to not only look at what we're interested in doing, but ask in the community, what does the community need us to do? And learn from the community what their needs are and how those can be better incorporated into what the strategic aims of the medical center are. And that process is already in place. One of the interests in the community is how to increase physical activity and maintain a healthy lifestyle and a healthy weight. Now, that is not what most people at the bench would think of as being particularly high science. But it's actually a very difficult thing to achieve for everybody. And being able to maintain physical activity and maintain a healthy weight and lifestyle is going to be great for the community. And we're actively working on how to take that community interest and drive that into university programs.